Devin. I'm Melinda. I'm going to be your nurse today. How are you?
Pretty good.
Good. How is your hockey season going? I know you're a big hockey player.
Pretty good.
Is your season about over yet?
Nope.
And what level of hockey are you in this year?
Pee-wee?
Pee-wee? All right. Is this going to be your first year of Pee-wee?
Yeah.
Perfect. All right. Let me wash my hands here. I'll come over and shake your hand. Devin, how old are you?
11.
11 years old already. My goodness. All right. So it's very nice to see you again, Devin. Do you have any allergies I need to be aware of?
Nope.
All right. How tall are you, Devin?
4'10".
Okay. And how much do you weigh?
75 pounds.
Okay. And do you take any medications on a regular basis?
Nope.
All right. And what brings you in today?
Just a checkup.
Just a checkup. All right. Well, shall we get started, Devin?
Yep.
All right. So first I'm going to take your vital signs. Have you ever had your blood pressure taken before?
Yep.
All right. Well, that's what we're going to start with today, okay?
Okay.
Just grab what I need over here. All right, Devin. So as you know, this is going to go right over your arm. You can just stick your arm in there for me. Perfect. All right, it's going to give your arm a big hug and then it'll loosen up, okay? And I'm just going to listen while it does that. Go ahead and you can stretch your hand right up there if you want. It's probably a little more comfortable that way. Good job. Go ahead and take that off. All right, so next I'm just going to go ahead and get your pulse, okay?
Okay.
I'm just going to feel right by your wrist, okay? Go ahead and just relax your arm right there for me. All right. Good job. Are you having any pain or discomfort?
Nope.
All right. Next, I'm going to have you stand up and we're just going to measure your waist real quick, okay?
Okay.
All right. Just come right behind you here. Feel your hips here. I'm sorry. Perfect. All right, Devin. You can go ahead and have a seat. All right, so next what I'm going to do is I'm just going to feel your head. I'm going to feel your hair, make sure everything feels symmetrical to the other side, so matches up. If you have any pain or discomfort during this, I want you to tell me, okay? All right. Any pain or pressure there? No. And what about when they push right in the ear?
Nope.
All right. Just going to feel your ears going back here. All right, Devin, very good. Next, what we're going to do, Devin, is we're going to go ahead and I'm going to take a good look at your eyes, okay?
Okay.
Have you ever had an eye exam before?
Yep.
All right, so what we're going to do is first I'm going to have you read an eye chart. So if you want to hop down for me, have you stand right over here. And I want you to look at that eye chart down there. You can go ahead and step right up to the table, cover up one eye, and I want you to read as far down as you can, okay?
JHERLC.
All right, and then go ahead and uncover that eye and cover up the next eye. And again.
NOSZLEPH.
All right, and now let's go ahead and uncover both eyes, and I want you to read as low down as you can with both eyes.
NOSZLEPH.
Very good. All right, go ahead and have seat back up here. Next, I'm just going to throw on some gloves. I'm going to take a look at your eyes. I'm going to pull your eyes down just that skin underneath down just a little bit. Okay?
Yeah.
Just going to throw on some gloves here. Have you been having any eye problems at all, Devin?
No.
Any blurry vision, anything like that?
Nope.
All right, nice healthy eyes. And you wear protection when you play hockey over those eyes, right?
Yep.
Good. All right. Very good. Good. Any, so no pain, no discomfort at all?
No.
Very good. Open up your mouth for me. Go ahead and relax your mouth down. Good job. Just a little bit on you. All right, Evan. I'll just clean my hands again. You don't have to come that close.
Hmm?
All right, Evan. So the next part that we're going to do here is I'm going to give you a piece of paper and we're going to cover up one eye. I'm going to cover up the same eye as you, okay? And now what I'm going to do is I'm going to bring my finger in and I want you to tell me when you can see it, okay?
I can see it.
All right.
I can see it.
And
I
down
can
here.
see it.
All right, now the same thing with the other eye, okay?
I can see it. I can see it. And I can see it.
Perfect. All right, I'll go ahead and take that from you. The next what I want you to do is I want you to follow my finger with just your eyes and not your head, okay? All right, we're gonna do the same thing with the other finger, okay? Perfect. All right, next what I want you to do is I want you to stick right here at that knob area. And I'm going to put my finger up by you and I want you to alternate between looking at the knob and my finger. So go ahead and look at my finger and then back over that knob for me. And back at my finger and back at the knob one more time. Good job. All right, Devin. So next what I'm going to do is I am going to go ahead and I am going to shine the light in your eye. It's going to be a little bright, but I'll be as quick as I possibly can, okay? And just do a quick one real quick. Check those reflexes in your eyes. Good. All right. And then get really close in your eye, okay? Perfect. I'm going to do the same thing on the other side, okay? This just gives me a better picture of your eye in there. Beautiful. Good job. Okay. Next thing that we're going to do, Devin, is I'm going to go ahead and I am going to look in your ears. Have you had your ears looked at before? All right. So you know it can kind of tickle a little bit. Usually doesn't cause any pain, but if it does, I want you to let me know, okay? All right. And look straight forward for me. Perfect. All right, I'm gonna do the same thing on the other side. Perfect. Good job. All right, Devin. So next what I'm gonna do is I'm just gonna kind of feel your ears a little bit, make sure they feel normal. No pain, no earaches.
Nope.
Have you had a lot of earaches in your life that you know of?
Nope.
All right. Never had tubes in your ears?
Nope.
Look straight at me. All right, Devin. All right, so the next thing I'm going to go ahead and do is I'm going to go ahead and I'm going to do what's called the sniff test. I want you to plug one side of your nose and close your eyes really, really tightly for me. And I am going to put a scent by you and I want you to take a little whiff of it. Smell in right now. And tell me what you think that smells like.
Great.
Perfect. All right, let's go ahead and do the other side. Keep your eyes nice and closed for me. And I want you to tell me what you smell.
Coffee.
Perfect. Good job, Devin. All right, so next what I need you to do is I need you to go ahead and plug up one side of your nose for me again. And I want you to take a big deep breath in and let it out for me. Perfect. And let's go ahead and do the other side, okay? Perfect. Good job. All right. Just grab what I need over here. All right. And I'm just just gonna take a look in your mouth real quick, okay, Devin? Open up nice and big for me. All right, can I get you to look up a little bit for me? Perfect. All right, go ahead and stick out your tongue for me. Good job. Say ah.
Ah.
Good job. All right, now what I'm gonna have you do for me next, Devin, is I want you to smile for me, and can you frown? All right, and can you wrinkle up your forehead? Good job. Close your eyes really tightly for me again. Good job. And now I need you to puff up your cheeks like a puffer fish and then let it out. Perfect. Good job, Devin. All right, we're getting there. All right. Are we good? Break? Are we time-wise? Okay. All right, Devin, so what I'm going to do next is I am going to have you go ahead and I want you to put your arms way above your head. Good job. Out to the side. Straight forward for me. Good job. All right, and then I want you to come behind your back. Put your fingers and lean forward. All right, and then out to the sides. Straight forward. All right, and then I'm going to have you go ahead and lock it behind your hands again. All right, and then out to the side. And then straight forward towards me. Perfect. All right. Go ahead and relax at your side. Now what I want you to do is shrug up for me, okay? Can you shrug your shoulders up? All right, now fight against me. Perfect. All right. Then I'm going to look at your arms here, okay? Just going to check your skin out. Look at your fingertips. All right. Same thing on the other side, okay? You doing okay so far?
Yep.
All right. No pain, discomfort, stuffy nose, nothing like that going on today? All right. Good job, Devin. All right. So next what I'm going to do is, just a second here. Next, I'm going to grab this. All right. So Devin, I'm just going to turn this light off real quick so I can see your neck a little bit easier, okay? Turn it back on as soon as I'm done, okay? Get your face that way for me. Perfect. All right, just got 1 second. Good job. All right. I'm just going to take a listen real quick. All right, I need you to take a big deep breath in and hold. All right, go ahead and let that out. We're going to do the same thing on the other side, okay? Go ahead, I need you to turn your head that way for me. All right, big deep breath in and hold. All right, I'm just gonna put my light down and turn the light back on. You doing okay so far, Devin? All right, I'm just gonna bend over and your neck a little bit more, okay? Straight at me. If it's uncomfortable at all, I want you to tell me, okay? All right, what I need you to do next, Devin, is I need you to put your shoulder to your ear. Can you look side to side for me? And then head all the way up. And then chin down to your chest. Good job. Any pain or discomfort when you do that? Okay. All right, next I'm just going to feel your elbow here. All right, go ahead and pull your arm up for me. Any pain or discomfort there?
No.
All right, we're going to do the same thing on the other side, okay? Go ahead. Good job. All right, next what I want you to do is I want you to go ahead and put your hands up in the air, fingers together, make a fist, back up, pick your thumb, drop, relax your wrist, bring them together. All right, good job, Devin. All right, I'm going to take a listen from the back, and I'm going to feel your back. Are you doing okay?
Mm-hmm.
All right, any pain or discomfort in your back? Any back issues with hockey at all?
No.
All right. Go ahead and take a big deep breath for me, and let it out. All right, Devin. I'm just going to do a little tapping back here. Shouldn't hurt at all. Do the same thing on the other side, okay? a little bit more into it back here, just right down here. If that hurts at all, I want you to let me know, okay? That hurt at all? I'm gonna go ahead and take a listen to your lungs now, okay? I need you to take some big deep breaths in and let them out for me. Same thing on the other side. Alright, I'm just gonna take a listen to your heart now. You can go ahead and breathe normally, okay? Nice, strong heartbeat, Devin. Alright, I'm gonna do the same thing. Wait, I'm gonna use the other side of my stethoscope. It just lets me hear things a little differently. Next, what I'm going to have you do, Dawn, is we're just going to lean forward a little bit, okay? I'm going to listen to your heart again. It just helps check for a lot of different things. All right, good job, Devin. You can go ahead and lay back. I'm going to have you lay on your left side and kind of scoot to this edge over here, okay? I'm going to listen to your heart sounds again. All right, you can go ahead and roll over onto your back for me. Listen to those heart sounds one more time. Really thin crest. And listen to your stomach. Appetite's been okay? Yep. Any nausea, vomiting? No change in appetite? Alright. Alright. I'm just going to kind of fill in your stomach, okay? Shouldn't hurt at all, but if it does, I want you to tell me any pain or tenderness anywhere. Alright. Same thing. If it hurts, I want you to tell me. I'm going to push a little bit harder. If this is uncomfortable at all, let me know, okay? Just feel a little bit of pressure. Doing okay so far? Mm-hmm. And I just got to go a little bit lower. I promise I won't go too low on you. Next, I'm just going to look at your legs, okay? I see you've got a lot of bruising. Is that from hockey?
Yep.
Are you wearing all your protective gear in hockey like you're supposed to be? I'm going to just feel your pulses here, okay? Nice, strong pulses, Devin. All right, I'm going to check one of your reflexes in your feet for me. You can just go ahead and relax. It might tickle a little bit, but it shouldn't hurt. Doing okay there, Dev? All right, good job. All right, now next what I want you to do is I want you to go ahead and I want you to turn your ankle in and then bring it out with just your ankle. Good job. And then out towards me. And the same thing with this foot, okay? Just your ankle. And then rotate your ankle out for me. Good job. All right, and then can you point your toes towards that door? And bring them up towards your nose. And then same thing, go towards that door. Towards your nose. Good job. All right, Devin. What I want you to do next is let's go ahead and bend this leg up. Bend your knee. All right, and then I want you to go ahead and let's take it straight into the air for me. and back down. Alright, and then bring it out towards the side for me. Alright, and back to the middle. Any pain or discomfort with that one? Same thing with the other side. Let's go ahead and bend it up and back down. And then let's go up, straight up. Good job. Back down, and then let's go out to that side. And then back in. Any pain or discomfort there? Alright, I want you to bend up both your knees one at a time. Alright, and then I want you to put them back flat one at a time, okay? Good job. Alright, next one I have you do is I want you to take this heel and I want you to run it down your shin. Perfect. And then the same thing on the other side, okay? Good job. Alright, you can go ahead and sit up. I'm going to have you come to the end of the table. I'm going to grab what I need here. We're going to check a few things out here. What I need you to do is I need you just to really quickly, there's still everything. Put your finger on your nose and go to my finger. Same thing other side, okay? Perfect. All right, and then what we're going to do next is I'm just going to check your pulses or your reflexes here, okay? Alright, I'm just going to move this bench out real quick. We're just going to check your lower forces, okay? Alright. Just put that back. Go ahead and have you stand up for me, okay? Just going to check your spine out. Alright, go ahead and bend over and touch your toes. And back up for me. You take your ear and I want you to go to your shoulder and then to your other shoulder. Okay, and then I want you to look up and then look back down. Alright, and then side to side with your head, okay? Alright, and then next what I want you to do is I want you to walk heel to toe to that door and then we're going to turn around and come back, okay? Job done. Do you have any questions for me today?
Nope.
Any concerns?
Nope.
All right. Well, it's been very nice seeing you again. If you come up with any problems or anything, just have your parents call and get you back in, okay?
Okay.
All right. I'll be seeing you around, okay?